Hey, you guys. So let's talk about a topic I don't think gets a lot of press, and that you may not be fully aware of. And that topic is perimenopause. Not menopause, perimenopause. And in this video, we're going to talk about what perimenopause is, how it's different than menopause, how do you know if you're going through perimenopause, and then in another video, I'll talk about holistic approaches, hormone replacement therapy, all the things you can do about perimenopause and menopause. But we'll talk about that in another video. But today, if you're interested in what are the symptoms of perimenopause, how do I know if I'm going through perimenopause, then keep watching. So what exactly is perimenopause? So let's start by talking about what menopause is. Menopause is when you go 12 months without a cycle. And that day where 12 months and you haven't had a cycle, that's what we call menopause. And every day after that we call postmenopause. So the time period up until that point is what we call perimenopause. Now, I'm going to actually talk a little bit about puberty to give you some context, because puberty is a topic that you probably know a little bit more about. So in puberty, we typically think of when a girl starts her cycle, has her first period, that is when she is in puberty. But the reality is that puberty starts much earlier than that, right? So when you start to see changes in their body, they may be developing hair around their vaginal area, under their arms, their voice might change, their hair might change, their weight, the way that their body shape changes. All of these things may happen before they actually start their cycle. And we are very much sort of aware that there's a transitional period. Well, women also have a transitional period before they stop having a cycle. And so that transitional period is what we call perimenopause. Now, that period of time can be 8 to 10 years before the end of your cycle. And there can be symptoms that are different in the very beginning of perimenopause versus the middle of perimenopause towards the end. The symptoms that get a lot of discussion might be things like hot sweats or insomnia. Those are the really big ones that even in medical school we talked a lot about. But really, we again only really talked about that after menopause or after you stopped having a cycle. But the reality is that women were experiencing these symptoms before their last cycle, and were just sort of being ignored or kind of blown off. The thing that I think that most people aren't aware of, and I'll tell you that I wasn't aware of it, medical school, residency, clinical practice, was not aware that a lot of the symptoms that happen earlier on, things like weight gain, maybe some sleep disturbances, but also some anxiety, depression, brain fog, difficulty making decisions, a lot of mood swings. A lot of these symptoms happen early on in perimenopause. And that has to do with the decline in our hormones, and changes in our behavior are the result of those declines. Just like changes in the behavior of a, pubescent teenager, right? Your 12, 13-year-old who has mood swings and is crying for no reason. We accept that, oh, that's their hormones. Well, if that's happening to you when you're 40, 42, 45, 48, it's changes in your hormones. We've got to get to a place where we're just like, oh, yeah, I know what that is. But for a lot of women, and even for myself, we're like, I have no idea what's going on. Right? You're feeling depressed, you're feeling anxious, you're gaining weight, you go to your doctor, and what do? They say, oh, you have insomnia, let's give you a medication. You're depressed, let's give you a medication. But no discussion about, oh, this is a normal part of aging. Are there things that we can do to optimize this process so you're not experiencing all of these symptoms early on, and you can mitigate possibly by either through behavior change, lifestyle modifications, supplements, or even hormone replacement therapy, we can mitigate these symptoms. This is something that is not really ever addressed, at least not in conventional medicine, and at least not quite yet at this time. But we're at this great point in time where people are starting to talk about it. Halle Berry's talking about it, Oprah's talking about it. Medical science literature is going up, which is what's budding a lot of these conversations. You're starting to get more books about women's health. So there's a lot happening right now around women's health, and that's why we're talking more about it. But the question or the problem that I still see is that a lot of women don't even know that this research is being done. They don't know what's the knowledge that we've gained over the last decade as it pertains to women's health. So let's talk about some of these symptoms and what might actually be happening and when they might be happening and how would you know. So oftentimes people are like, oh, like I need to check my hormones. And I do check people's hormones. I test them. But really, you're going to know that your hormones are changing well before I'm able to detect it in your labs. The labs can be helpful in gauging, what's absolutely going on. You may find doctors who don't look at labs at all because they're going simply by symptoms, because symptoms really tell the story. And the reason why symptoms tell the story is because everybody's different, and you knowing your body is going to be more insightful than any lab that I can get, because a number in me may mean something different than that same number in you. So there isn't like this one-to-one correlation where I can test your estrogen, progesterone, and testosterone, and I'm like, ha, there's the cutoff. That's not how it happens. So what are some of these symptoms so that you may be noticing? So one of the big ones that people come to me with is often going to be weight gain. So as your hormones start to fluctuate when you get older, your hormones start to have a different effect on your fat cells, and you start to develop more fat around the midsection. And this is actually quite normal. The reason your body's doing this is because your fat actually produces hormones. And as your ovaries, which normally produce your hormones, start to decrease the hormone production, it's saying, oh, well, let's make more fat so that we can continue to maintain some hormones, and that fat can start to generate the hormones we need. So our bodies are doing it as a normal consequence. But if you also are compounding a lot of other things that are happening in a woman's life at this point, meaning stress, poor eating habits. If you've had poor eating habits your entire life, that's going to be exacerbated during this time. If you've had really healthy eating habits your whole life, you may notice that what you were eating isn't working for you anymore. You working out may also change, right? The types of workouts that you did before are no longer working. So as you start to notice this change, like, hey, something's changing. I haven't changed, but my body is changing for me. That's a great sign that you are in perimenopause, meaning your hormones are doing some funky fluctuations. And what happens is, I have a whole graph on this, maybe it's in a different video, but what's happening is that your estrogen is going up and down, and it's still going in it, but it's working its way down to nothing. Your progesterone is working its way down, and your testosterone is working its way down. But at this time of your life, probably your stress levels are working their way up, your toxin levels are working their way up, and so you have this, precipice. You have this moment where things collide and shit hits the fan. And for some people we call that a midlife crisis. Some people we just call that aging, right? But the reality of it is there's a good biological explanation for that. So you notice that you're gaining weight, or and the things that you've been doing haven't been working. The other things that I oftentimes see are depression, anxiety, overwhelm, burnout. So things that you could handle before, you no longer can handle. So you're easily overwhelmed. Maybe it's even more difficult for you to make decisions. And you're feeling more stressed. You might even feel depressed. These could all be symptoms of perimenopause. And again, we may just write it off as depression, but the reality of it is that we can take some holistic approaches. Maybe we need to, support your hormone balance a little bit more, rather than just giving you a pill like an SSRI or an antidepressant. So part of this process of finding out if you are having symptoms is really knowing your body. So if you aren't in perimenopause, this information is really important to know, because it gives you something to look for, right? So you when these changes start to happen in your body, or you start to notice this, you won't think something's wrong with you. You'll say, okay, I'm going through perimenopause. Now what? Now we can start to make decisions. But if you're completely overwhelmed with the symptoms and have no idea, like I was, and confused about what was happening with my body, well, that leaves you with, searching for answers, going to doctors and trying to tell people what's going on, and people giving you answers that may not help. So knowing that these symptoms can be perimenopause can be very helpful. Other symptoms, insomnia, so difficulty sleeping. That was one of my very first symptoms. Just not being able to go to sleep, my mind's racing at night. Again, that may also be related to stress, but you compound that with your drop in your hormones, and it's a nightmare. You may also notice that you have achy joints. So I also noticed this in my body, that things that like this shoulder just started hurting more. And I was like, wait, I've been able to do things my entire life and never have pain. And now I have pain. I hear this all of the time. Just a little anecdotal story. I do yoga. I stopped doing yoga during the pandemic. I went back to yoga, and I don't know what happened, but I just could not recover. I would stretch, the places where I would stretch would hurt for literally months on end. So again, that may also be a change. You may also notice differences in your skin or hair. So you might start to see more hair loss. You may also see acne during this time. You may see that you're starting to have droopy skin. Again, all signs that your hormones are starting to fluctuate. You may have changes in your vision. So those would all be things that you may not have attributed to perimenopause, but can happen early on in those stage, in that time frame. And you know, for a lot of women, that happens in their mid 40s to late 40s, but it can start even earlier for some women. The other thing I want to mention is fertility issues, and I have to do a whole other video on this, but for a lot of women, I find that they do not realize that their most fertile time is before the age of 35. After 35, your fertility goes down. Now, it doesn't mean you can't have children after 35. Many people do. But that may not be your case. So there are many people who have difficulty having conceiving after 35. We see a lot of more people going through IVF and needing support. And I think part of that reason is because women are having children later, but they also don't know that their fertility is naturally going to go down because their hormones are fluctuating and changing at this period in their life. So I really think it's important to really have these conversations with women younger so that they can start to do family planning, have a better sense of what changes might be happening in their body. And if you're above 35 and you haven't had children yet, then you may want to start thinking about saving eggs or doing certain things to help with fertility later on if you want to get pregnant later on in life. Doesn't mean that you can't. It just means that you might need to make some decisions to help support that process. So I say that because fertility issues are also a sign that there are changes in your hormones. So you also may notice that your periods may become more irregular, or they may just change. So again, if you don't know what your periods were doing in your 20s and your early 30s, you may not even notice that things are changing. And I have to be honest, even for myself, I didn't track my cycles as a younger person. So it wasn't until later in life that I started saying, oh, I need to start paying attention to this. So, you know, knowing how many days your cycle is. So, you know, how many days between your cycles. So the average is somewhere between 26 and 35 days between cycles. And usually that's pretty regular if your cycles are regular. For me, I'm every 28 days. As I started to get older, it started to become every 26 days, sometimes 24, sometimes 27. That was not something that was happening before. So I started to notice these irregularities. Your cycle might be changing in its intensity. So maybe you have heavier periods to lesser periods. Maybe you went from having a cycle bleeding for 7 days down to 3 days, or maybe from 3 days up to 7 days. So these little nuanced understandings of your cycle can be really important. And I have a whole other video on using your cycles as a vital sign. But just knowing that your cycles are changing also might be a sign of perimenopause. So then there are some other health consequences. And this is always, I don't know if it's surprising to me. Yeah, I have to say as a physician that it is sometimes surprising, and I didn't have a way of really expressing this to my patients in the past. But now this is what I tell my patients when they come to me and they say this very specific phrase. I've always been healthy until. I hear this from men and women. I hear this from everybody. But they always say, I was always healthy until I got diagnosed with diabetes. I was always healthy until I got diagnosed with high blood pressure. And when people say that, what I'm hearing is that they assumed that this diagnosis kind of came out of the blue. Like they were doing everything right, and then out of the blue, this disease came, and then things started to decline. And the reason that's shocking to me is because as a physician and as a holistic practitioner, I understand that these diseases don't come out of the blue. They develop over time. They develop over decades. And so even though you did not have the diagnosis until someone actually gave you the diagnosis at a specific diagnostic point, so your blood pressure went up or your blood sugar went higher or your cholesterol went higher and your lab started to hit these markers, but there were probably indications much earlier on that you were on that track, you were on that trajectory. And so it did not just happen overnight, it's that it's hit its peak. And then once you've developed that condition, diabetes, high blood pressure, high cholesterol, whatever, autoimmune condition, it's kind of like you've gone over the hump, and now things start to decline in the way that you feel and all of these other things. But one of the things that contributes to people getting over that hump, where they're like doing okay, but their health is actually declining, but the risk factors are going up, and then they get to this precipice and they hit the mark where they start to notice it in their symptoms. That's what I mean by over the hill. You make it over the hill when you start to notice the symptoms in your body. One of the things that can trigger that is a decline in your estrogen, progesterone, and testosterone. So particularly for things like heart disease, high cholesterol, high blood pressure, all of these things are affected by your hormones. And so if you start to hit that point in your life where your hormones now are starting to reflect in your labs, that needs to be addressed, not just by giving you a medicine for your cholesterol or giving you a medicine for your blood pressure. We need to also address the issue of your hormones. So I think I've covered everything. So I'm just going to give you a real good summary of some of the symptoms that you might notice with perimenopause, just so I encapsulate everything. So weight gain, anxiety, depression, difficulty making decisions or brain fog, sleeplessness or insomnia, waking up in the middle of the night, achy joints, headaches, changes in your skin, changes in your hair, changes in your vision, generalized weakness. I didn't discuss this, but loss of muscle mass is another big one. Irregular periods, and then diagnoses such as high blood pressure, diabetes, high cholesterol. So these are just some of the symptoms that you may be experiencing in early perimenopause. Now later in perimenopause, they may exacerbate these same symptoms, but this is when you start to notice maybe hot flashes or really some difficulty with sleep or night sweat. Some of the other symptoms that people associate with menopause tend to happen later in perimenopause or early menopause. So we spent a lot of time talking about hot sweats, but these other symptoms can't be ignored either. So in the next video, we'll talk about, the treatment approach. So how do we approach perimenopause? Should you go on hormones or not? What are the risks and benefits of that? And what else can you be doing from a holistic standpoint to address this? So I hope this was helpful, and I will see you guys in the next video.